Welcome to the video user guide for the Pulmodyne BiTrac Oronasal NIV mask. This video guide will provide an overview of sizing the masks, each key feature and using them to full effect, managing the leak from the mask, and finally, maximising patient tolerance during therapy. The BiTrac mask is available in 4 sizes: small, medium, large and extra large, with 2 sizing methods available to confirm the correct fitting. The first and most common sizing method for the BiTrac mask is a large reusable card containing a guide hole for each size. As the picture on the guide shows, hold the guide over the patient's face, placing the top edge of the hole on the bridge of the nose. The bottom edge should sit between the bottom lip and the crease of the chin. If the bottom of the guide begins to cover most of the patient's lips, the mask will be too small. Alternatively, if there is a large gap between the bottom lip and the bottom of the guide, the mask will be too big. When finished, simply clean the guide with a disinfectant wipe to be used again and store. The second sizing method available is a small single-use guide which provides a good backup option if a reusable guide is not available. Before using this guide, ensure you have the correct side, as the other will size our total face NIV mask. The correct side will say full face sizing by the yellow arrow at the top. Once you have the correct side, point the arrow towards the bridge of the patient's nose. Now, imagine a line coming outwards from just below the patient's bottom lip. This line will intercept one of the size zones on the guide, which will be the correct size for the patient. If you notice your department is running low on sizing guides, contact your VentMed representative or email info@ventmed.com to organise restocking. The headgear is secured to the top of the mask by Velcro straps on both sides of the interface, which are pulled through and attached to tighten. These contain a second Velcro tab, which can be used to reduce the size of the headgear for smaller heads or patients with little or no hair without causing excess strapping. Simply pull the second Velcro through the loop and stick down. The remaining strapping can simply be removed by cutting or stuck down to the headgear. To attach the headgear to the bottom of the mask, place the clips at the angle shown and push down onto the top to lock it into place. You should hear a small click when attached. To remove, simply bring the clip to the same angle it was attached, place your thumb on top and turn it towards yourself in a key-like fashion. If a clip is ever lost, simply pull the strapping through the loop on the mask and use the Velcro tab to stick down. The Omniclip can be used to adjust the forehead support to accommodate varying facial profiles and maximise comfort and leak management. Simply pinch the clip to move the head support up and down or in and out to reach your most desired setup. The Omniclip operates on a hinge. Detach the bottom 2 clips and swing the mask outwards to allow the patient to drink. The mask's cushion consists of 2 layers of thin silicone which the airflow moves in between to inflate and to fit to the patient's face. If you are experiencing too much leak, before attempting to tighten, we recommend firstly loosening the mask to allow the mechanism of the double layer cushion to function. The mask elbows are removed and attached through a bayonet style locking mechanism. To attach, insert the knobs on the elbow into the grooves in the attachment area of the mask. Hold this attachment area to prevent spinning and twist the elbow to lock it into place. To remove, repeat this process in reverse. The bayonet elbows come already attached to the masks. Therefore, unless removal is required, simply connect the ventilator tubing to the elbow to begin therapy. The BiTrac mask has 3 oxygen entrainment ports in the interface, with 2 found at the bottom of the mask and 1 under the elbow. Before and during therapy, check each cap to make sure it has not come off or been removed. If you see one has come off, simply recover the port with the cap and continue therapy. To optimise leak from the mask, firstly make sure you have the correct size for the patient, which will allow leak to be more manageable if correct. Check all 3 oxygen entrainment port caps if leak is unexpectedly high. Remember there are spares of these provided in the event of a loss. Ensure your ventilator is on the correct setting for a total face style mask, for example setting 2 on Philips machines. Aim for a leak between 20 to 60 litres per minute. Aiming for 0 would lead to over-tightening and likely cause discomfort for the patient. Check the strapping has been secured correctly, remembering to use the second Velcro tab for patients with smaller heads. You should be able to get 1 to 2 fingers between the headgear and the patient's head. If this isn't possible, it is likely to be fitted too tightly. Lastly, ensure the floating cushion is functioning properly. You should see it move slightly in and out from the patient's face with the differing pressures. To optimise patient tolerance and comfort, firstly ensure the patient and the ventilator are synchronised. Remember to educate the patient before and during therapy. If they understand better what is happening, it will relax them for the procedure. Public Health England recommends the use of opioids or low-level sedations to improve tolerance when required. If you'd like to learn more about VentMed's full range of NIV interfaces, including the paediatric and total face NIV masks, please contact your VentMed representative.